Hi, I'm Donna Davis, and I'm here today with Dr. Bill Keating, and he is here to answer all of your medical questions. So thank you for being here, Dr. Keating.
Oh, Donna, thanks for having me.
So today we've got a lot to talk about. It's a beautiful day here in Georgia. The sun is out, but with that come a few health issues. So we're going to talk about, I'm just going to name the topics real quickly and then we'll get into each one of those. But it's melanoma month. We're going to give you the warning signs and symptoms of melanoma. And we're also going to talk about allergies. This is the time of year when there are a lot of seasonal allergies. We're going to talk about weight loss, which is an ongoing thing for most people, but particularly in the summer, most of us just think, how can we lose those last few pounds? Or you just want to start, your diet program. And the Keating Family Medicine has now started a weight loss program. So we'll talk about that. And then we'll also talk about addiction. So we got a lot of things going on. We're also answering your questions. So feel free to just put your question in the comments and we will get to that. So first of all, let's talk about Melanoma Month. It's very serious. But what are you seeing in your practice as far as melanoma cases?
Well, like we were talking about before we started, it's something we've been aware of for a long, long time, and have seen a little bit of a rise in just the incidence in my practice. But the patients develop it seem to be older, and what's been nice is once they've been treated, they're symptom free and they've done very, very, very well.
That is good. And you said that they have a much better outcome now, that the big key, right, is coming in early and diagnosing it early, right?
Oh, absolutely. That is the whole thing, and I think people are more aware of it, and are more. They'll come in much faster if they see a spot that they think looks concerning.
Well, so let's talk a little bit about what they need to look for. It's called the ABCs of melanoma, and we have a graphic that we can bring up. And let's go through each one of those because it's a great time that if you or someone you know has a spot that looks a little strange, you can just remember these ABCs, right?
That's right. Well, the A stands for asymmetry, and what that means is normally the things on the skin are going to be round or very even, and when they're asymmetrical, it means they're uneven, jagged edges, and just look irregular. So that's what asymmetry means. Then the B is the border, and the border normally is really smooth, might be a little bit raised, and just even all the way around. But with melanoma, the border tends to blend into the skin, might be raised, but it's blending in sort of just a murky, fuzzy border. And then the C stands for color, and the color is going to be it's irregularly pigmented, might be bleeding a little bit, but it's going to be just different colors. It can even have a blue or red in it, but it's just irregular. That's what that stands for. The D stands for diameter, and usually, like you mentioned before, the size of a pencil tip. Half a centimeter or centimeter. Those are real sizes that would be a little more concerning than if it's smaller than that.
And then evolving.
Yes, yes, evolving. Changing sizes, getting bigger. Hmm.
Yeah, so if you have something that looks a little strange, but it's not growing, should you still maybe go to the doctor, or should you just consider that if it's not growing, it might be just normal?
Well, if it's not growing and it doesn't have any of the features that we've talked about, then you can watch it.
Yeah,
And typically, somebody else in the family will see it and you're not even aware of it.
yeah.
And yeah.
So melanoma is the most serious type of skin cancer, but there are some other ones too. Do you want to kind of quickly go through those at all?
Oh, right, yeah. Well, the most common one is where you get a scaly skin rash, and that's just it's called solar keratosis or actinic keratosis. That's just this undamaged skin, and that happens as you get older. People that have been out in the sun a lot, golfers get it, tennis players get it. Um, People who've just been out in the sun for a long, long time when they're younger, and it pops up when you're older. And if you treat those, you just freeze them, and those go away. But they can evolve into a squamous cell cancer, and that can be treated easily. But yeah, you want to that's a real common one. And then the other most common one is a basal cell. And
Yes.
those can grow and can look a little bit ugly and pretty, can bleed pretty easily. And these are all lesions. If you're concerned about any of them, it's just best to go in and have your doctor check it, check them out.
Yeah. So at this point, we are going to come back. We're going to leave you with that trivia question, and then we're going to come back. And next up, we're going to talk about allergies, which I think you can relate to.
I've struggled with depression since I can remember.
I just felt like I was just falling and falling.
I told her I didn't want to live anymore.
I thought it would be better just to end it.
I tried to kill myself.
I actually tried 4 times.
I tried to overdose.
I have attempted suicide. I don't know a kid that hasn't dealt with anxiety and or depression.
You're not the only one who has this problem. Other kids have the problem.
Just because you're crying doesn't make you a weak person. There's always a way to overcome it.
Working together, you can get through it.
Do you know that you're in my lane? No, not at all. Are you not paying attention? Are you texting? I was just checking in with my mom. I was telling her that I thought we'd be home by 6. It's okay. There's enough time. Just pay attention. I'm not even halfway through my text. There's no way. I'm not even going to look up. My babies are in the car. You have to pay attention. It's just supposed to be a quick text. I'm so sorry.
Let's talk a little bit about seasonal allergies. What are people really experiencing right now? Is pollen still the issue? I know it was laying everywhere just a couple of weeks ago, but it's getting better, right?
Oh, it definitely seems to be. My car doesn't seem to be quite as yellow as it was a month ago, but it's still annoying. And allergies are still out there. Mm-hmm.
So what should people do about an allergy? What kind of things should they go to the doctor and get tested? Do you recommend just taking some over-the-counter things?
Generally, allergies are pretty common and can usually be treated by, over the counter. Gosh, there's so many more medicines over the counter now. And I would start with a nose spray. There's a steroid nose spray, and would take, two squirts on both sides of your nostrils at nighttime. And then if that doesn't, you still have symptoms, and a Claritin or Allegra during the day. But everyone talks about the sneezing, the itchy eyes, runny nose, but also the energy. The most common symptom is just being really, really tired and really dragging. And you probably want to go in to see your doctor if the symptoms are just just aren't responding to over the counter, or it's just really, you just find yourself really fighting it and you just can't get ahead of it.
I'm sorry, go ahead.
So sometimes you can also develop an asthmatic cough with this, where you're coughing and wheezing. And if you have that, you definitely should go and see somebody.
So allergies can easily go into sinus infections, though, can't they?
Oh, yes. Mm-hmm. And it's really hard to know if you have an allergy or sinus infection, and because if you treat allergies with an antihistamine like Allegra or Claritin, if it's an early cold or early virus, that'll actually aggravate those symptoms and lead to a sinus infection. But so you're really
Really?
right. Mm-hmm.
I
Mm-hmm.
didn't realize that. And how does that happen?
Well, what happens is it dries up the mucus in your sinus cavity, and then that gets infected. Whereas with
Oh, okay.
allergies, you're trying to keep it from getting there. But for a cold, if you take antihistamines, it dries it up, like I said, then bacteria get in there, and it really leads to a pretty nasty infection.
Yeah. Yeah. I know people that have that, and I feel so badly for them, especially like it seems like whenever the seasons change, that it's the worst.
Right. Now, the way you want to treat that, that's a little different. You'd want to take like a decongestant or Mucinex D, and that'll help that stuffiness, that congestion a whole lot better than taking an antihistamine.
Yeah. Have you noticed at all that anything's changed with allergies or allergy treatments over the years that's been interesting in your practice?
Well, the nice thing is the medications are over the counter now. So it's a lot easier for patients to initiate treatment sooner.
მინდა გავხდე სტუდენტი და უფრო მეტი ვისწავლო. კონდეს საინტერესო ცხოვრება. მივახციო წარმატებას. ვოცნებობ გავხდე ქირურგი, რომ ბევრ ადამიანს დავეხმარო. გაგრძელე სწავლა. აისრულე ოცნება.
Knowing what's underneath your feet is important, especially when you're planning to dig. Contacting 811 before you dig, even for small jobs, prevents potential injuries and service interruptions. Just submit your request at least 2 business days before your work to have underground power lines and other buried utilities marked. There's no cost. Oh, you're right, Digger. It's easy to submit your request online at mygeorgia811.com on your smartphone, tablet, or computer. Georgia Power and Georgia 811, working to keep you safe and connected.
Started at a party, everyone was there. She had a couple pills on a little dare, but now she's missing class and she's dropping her pom-poms. Nobody knows where she is, not even her mom. Everybody thought she was the all-American girl. So there goes the books, it's all about the score. There goes the doggy, life is such a bore. There goes the family, she's got a new friend. There goes the looks, this is the end. I guess she really was the all-American girl.
Pick up heroin and you'll throw away everything you love. Share your stories on Instagram with #heroin.
So we're back now with Dr. Bill Keating, and he's here to answer all of your medical and health questions. He's a family physician. And so let's talk about weight loss. So this time of the year, a lot of people are concerned about their weight and wanting to look their best. And you have this new weight loss clinic. First of all, tell me why you wanted to open that.
Well, it's a problem that all of us struggle with, and in the practice, there's probably the majority of medical problems stem from weight loss or weight issues, and so it's something that we always encourage, always try to help patients, to do. But then a nurse practitioner came to us who'd been working with a bariatric surgeon and was interested in joining our practice, and we thought, gosh, that'd be awesome. So she joined us and is really helping a lot of our patients.
And what's different about when you go to one of these medical weight loss clinics as versus trying to do it yourself or maybe getting a Fitbit or getting Weight Watchers online, that kind of thing? Tell me a little bit about some of the different options and how they differ.
Well, in the office, we really talk to patients about the type of foods that they should be eating, exercise, like you mentioned, and encourage them. And sometimes we even use medication. But with Emily in weight loss, it's really neat. She tries to find out why it's an issue, where the struggle is, and really helps customize a program, based on where you're struggling. And so that's been really fun to see. She's actually working with all of us on the staff.
Oh, really?
Yeah.
And so how has your staff done?
Well, they're doing well. She's only been here about 3 weeks, but we have a new scale, and this scale can measure your body fat, your muscle mass, visceral fat, how much water you have, what your metabolic rate is. And it's been a real eye opener for all of us, and it's been helping us know where we really need to be working, cutting calories, increasing exercise, that type of thing.
That is interesting. So does she give you a certain calorie count that you need customized to you and your, body mass index and that sort of thing?
She starts with that, and talks about energy, activity, things you need to be doing, and it helps you customize a meal plan. Mm-hmm.
Do you ever think that there are emotional issues with that as well? Like maybe people who eat because they're anxious, or they eat because they're depressed, or that kind of thing? Do you guys address any of those kind of issues that might go along with weight loss?
Oh, that's clearly involved with it. Like I noticed it myself when I'm studying hard for tests or boards, how much more you eat, or you don't eat well if you're running the kids to different soccer programs or different sporting events, or just really, really busy, how you don't eat as well. So that's a big issue, absolutely. Mm-hmm.
Yeah, I've always thought, it comes with almost with every advancement, there is something that you lose, or that it creates another problem. And I think with all of our advances in technology and that sort of thing, those have become so much more important that now we all sit in front of a computer almost all day long, like 8 hours. I mean, our ancestors could not have imagined a time when you weren't out having to actually do work in order to, you had to either farm or you had to go to a factory. And these lifestyle changes are just going to continue. What do you think about that sort of thing?
Well, not only you sitting, but you're always working, and you don't have the downtime. You don't have time to get away and sort of give yourself a break. So the pace just gets faster and faster. I mean, even with our cell phones, you can never get away.
Yeah.
And I think that
go ahead. Sorry.
I think that's as big an issue as the activity levels.
Yeah, and I do think, when somebody holds you accountable in a program like that, and you're going to weigh in and that sort of thing, that helps as well.
Oh, that clearly does. None of us like that.
Yeah, we don't like it, but we know it's going to happen.
I include myself in that one.
Yeah. Okay, so we're going to go to another quick trivia question. We're going to come back and talk about addiction medicine, because I know that's something near and dear to your practice and to your heart. So let's test our viewers' knowledge and be back after this.
Opioid addiction can happen in the blink of an eye to anyone. 4 in 5 new heroin users started out misusing prescription pain medicine. As they began to misuse and overuse, they started down a path to addiction. Tell your doctor about any personal or family history of addiction. Make sure you understand the directions and follow them exactly. Don't change the dosage without asking your doctor. Don't mix medications with alcohol or other drugs. Don't take anyone else's medication. Prevent misuse by talking with your doctor about other options, like over-the-counter pain medications, acupuncture and transdermal pain patches, holistic pain management, and lifestyle changes. Nearly half of all opioid overdose deaths involve a prescription medication. Stop the pain. Get help. Talk to a trusted adult or professional, or call 1-800-715-4225. We wouldn't open the door to a stranger, text while driving, let our children play with matches, or leave a knife within their reach. Yet we store our prescription medications in unlocked cabinets. 60,000 children are taken to the ER each year because they get into medicines that are left within reach. And many people who misuse opioids get them from a family member or a friend's medicine cabinet. If you have prescription medications, keep them locked away. Not only from family members or friends who may misuse them, but from kids and pets who could accidentally ingest. Always keep a count of your pills so that you will know if any are missing. Dispose of extra or unused pills in a take-back box, usually available at any police station. Don't share medications or self-diagnose. You may not have complete information and could send a message to your kids that this is okay. Stop the pain. Get help. Talk to a trusted adult or professional, or call 1-800-715-4225.
Let's talk about something serious, which is addiction medicine. I know that's something very near and dear to you. Tell me how you became interested in that aspect of medicine.
Gosh, it was really interesting. I went to a medical program just to learn about a new medicine that was coming out for addiction, and I just went because I needed some extra credit. And when I went to the course, I said I didn't think I had any patients that would benefit from this medicine, but I took it because I needed some CMEs. Well, 2 weeks later, somebody came in who had this problem, and I said, "My gosh, I have some medicine that can help you." So we started him on it. He was doing great, and about 2 weeks later, he called me up and said he needed more of it. And I said, "I can't just call in over the phone. You need to come in so I can see how you're doing." And he said, okay. Well, he didn't come in, and he called me up on Saturday night, said, that he needs this medicine. And he gave me this long song and dance about why he couldn't come in. And I listened to him. It was actually our anniversary, and we were out on a dinner date. And I said, "Dan, you're lying. You're a liar." And he started laughing. "I know." And, that was my first real introduction to it. And from then on, it's like, how can you not love somebody who really realizes that they really have a problem and they really can't tell the truth?
Right, and there's a lot that goes with that. And there's a lot of lying and deception that goes with addiction. And then I think a lot of guilt and shame that makes recovery probably even harder.
There is a lot of lying, and the lying is exactly right because the shame that goes along with it. And that's probably one of the hardest things with addiction is just, when you've done something wrong, you feel guilty and you feel bad. But when you feel shame, that's when you feel that I'm bad and that there's something wrong with me. And that is such a hard place to be. And when you do that, you become more isolated. The shame gets deeper, and it's just a horrible place.
Yeah. And so tell me about how you bring some spirituality and that sort of thing into treatment and why you feel like that's important.
Well, what happens is a lot of times you feel like you take a drug, whatever it is, and you feel better. But what happens is all those bad emotions, everything just goes away, and you think it's the pill or the drug that's doing it, and really it's a matter of you're trying to manage life on your terms. You're trying to take control of other people and just trying to control things. And when I realized I can't, and you surrender. First of all, you're surrendering about the drug, but you're surrendering to that there's a higher power that can really help me with this and help me with my life. Then things can really start changing.
Yeah. And so you feel like, and have you really seen that in your practice? Have you seen that incorporating that spiritual element makes a difference?
Oh, absolutely. But we're all in a different path, and we all go different, in different paces, and you absolutely see it. And sometimes people go faster, sometimes they don't. And that's what we're here for, to walk along with them through this whole journey. But it truly, truly makes a difference. And, patients that come in because they want to get off their drug or whatever it is they're addicted to. And I want to help them do that. But really, I want to help them get a life. How can they be the man or the woman that they want to be, the husband, the wife, the father, the son? Just really be the person. And that's the gift of this whole thing. And that's what my hope is.
Right, and you're able to really restore families and all of this,
Oh.
because whenever it's one person, right, it's the whole family.
Oh, the whole family's involved. That's right. And the partner has, yes, you're right. Everybody is involved, and everybody can recover.
Yeah. Well, and you've seen some really good recoveries in over the years?
Oh, absolutely. Oh, yes. And that's why I love to do this and love to be part of that.
Yeah.
Mhm.
Well,
It
that's
is- it's-
wonderful. Yeah, I can tell you get very, very upbeat when you talk about it, which is something you don't always see when people talk about addiction. But I think your attitude that you can really help people and there is hope and that kind of thing is very uplifting.
Well, that's what patients, that's what they need, because they really, when they come in, they are so discouraged, so beaten down, and they really don't have that.
Yeah, and everybody needs hope. Well, thank you so much for being here, and we appreciate it, and we'll see you next time. Have a great weekend.
Oh, Donna, thanks. I enjoyed talking with you.
Thank you.